All right. Good morning, everyone. Thank you for taking time out of your morning to join us today on our Let's Talk Benefits webinar series. And today, I will be taking you through the accessing your chiropractic and acupuncture benefits. And then our partners at EyeMed will take you through their vision and eyewear benefits, all included in your MyCare plan. This should only take about 20, 30 minutes, and then we'll open up to questions. Okay. And my name is Eric Greathouse. I'm with the Western Health Medicare sales team, and I'll be providing my contact information at the end of the presentation. In fact, if you do have questions or need to raise up a concern, you've got your chat and Q&A functions on the screen there down at the bottom if you move your mouse around. And go ahead and type in questions, and we'll address those at the end. I've got everyone on mute now so that we can get through the presentation uninterrupted. Okay, so your chiropractic and acupuncture benefits are administered through Landmark Health Plan and are considered an alternative medicine to traditional medicine. So when you seek chiro and acupuncture, you will choose from the Landmark Health Plan provider list. And during the presentation, I'll show you how to access that from our website. Okay, with chiropractic and acupuncture, you do not need a referral from your primary doctor to seek care through these benefits because you have direct access to Landmark Health providers through the Landmark Health Plan website. The copay for either chiropractic or acupuncture is $20 with the MyCare plans. And it's for a combined visit of 10 total visits per year. So if you want to go like 5 chiro, 5 acupuncture, there's your 10. Or if you want to do all 10 chiropractic, that's how it works with the MyCare plan. Now, alternative medicine can help alleviate pain related to many conditions that affect the neck, back, and joints. It can even help with relief from headaches, asthma, and allergies. So to locate a landmark provider for alternative care, you can call the number that's listed here, or visit the website that's provided here on this page. Or, and this is what I'm going to show you now, you can click on the Partners in Care on the provider search page for Western Health Advantage, and I'll take you to that home page now. Let me get there. Okay. Everyone see a different screen on their computer, their device? Okay, thank you for that, Christine. I appreciate the head nod. Okay, so what you do to find a chiropractic or acupuncture is you're at the the Medicare.westernhealth.com website, and see this find a doctor or facility. You click on that, just simply click on. Don't worry about the drop down that comes below, and then click on this Medicare provider search here. Okay. And then the screen actually it's divided here down the middle. On the left, you have provider search, but over here under partners in care, this is where I want you to focus your attention. Notice if you go down here to where it says acupuncturist and chiropractor, and you click on that, it's going to take you to the Landmark Health Plan website. Okay. And when you're there at this Landmark Health Plan website, find a provider. You've got to scroll to the bottom. See this drop down here. You want to check Western Health Advantage. And then you want to type in, okay, I'm looking for an acupuncturist or a chiropractor. And then you enter in your home, your zip code. I'll put in a Sacramento zip 95833, maybe a 10-mile search from that zip. Hit search. Okay. And we should have, well, that's interesting that maybe I used a bad zip. Let me try this again. Western Health, chiropractor. Okay, here we go. So, and you'll see the names. You see, you have like nine different pages here of chiropractic um, practitioners. So that's how you actually access. And again, you don't need a referral for this. Okay. So now what I'll do is I'll introduce you to our partners for vision and eyewear through EyeMed. So let me go and stop sharing here so I can give this over to my partners here at EyeMed.
Thank you, Eric. I appreciate it.
You bet.
All right. So my name is Christine Dietz, and I'll be doing the training this morning for you guys. I'm actually out here in our Cincinnati office, so it is afternoon for us. However, I do have two of my colleagues who help manage the WHA account, who actually do all the managing for the account. We've got Bianca Zeffi on the phone, as well as Josh Ellis. So the three of us are helping to support you all. And so if you have any questions after this, you're free to reach out to us. Right. So my goal for this training is really to go through and share a little bit about why an eye exam is so important. And then after that, we'll talk through some of the network pieces, talk through some of the providers that you may find familiar within the network and how to find a provider as well. We'll go over the benefits as well, answering a few questions in there, and then what the standard member experience looks like when you go to a provider and receive a pair of glasses through them. So first, why get an eye exam? If many of you wear glasses, I don't know, I can't see any of you on the phone. However, I'm assuming some of you are wearing glasses. So unless you really need to go in and get an eye exam to get a new pair of glasses, a lot of people don't think to receive an eye exam outside of those needs, that the fact that they're seeing blurry, there's something in their eye. And oftentimes that's already too late to go in and get an eye exam, because we truly believe that eye exams are a great indicator for some serious health conditions. I won't name all of the things that are listed on here, but I think the thing that really stands out the most is the 3.4 million Americans 65 and up that have diabetic retinopathy. And for many of you who don't know what diabetic retinopathy is, it's actually the swelling of the vessels in the back of your eyes due to undiagnosed or untreated diabetes. The swelling can get so bad that a vessel will actually rupture and cause blindness. And so we all obviously want to make sure that we're going in and getting our annual eye exam to make sure that that's not something that's happening in the back of your eyes, because the earlier that we can manage diabetes, the less likely it will lead into diabetic retinopathy. But beyond just general health issues within the eyes or your overall well-being, I think there's a lot of other things that can be tied back to a good vision. We don't really necessarily tie these to good vision, but I think it's a good thing for us to think about when we think about why our vision is so important. For those who don't have great vision, we can see an increased risk in falls or fractures, the higher risk of depression, because let's say if you do end up falling or causing a fracture, you may not be as mobile, and that can cause you to be a bit more stagnant and, in that keep you indoors and maybe causing some depression. There's also difficulty identifying medications. We know pill bottles have a tendency to have very small writing on them. And so that can certainly be a problem, not being able to see the writing on pill bottles. And we don't even think about this if we have good vision or if we wear glasses regularly, but just difficulty in your day-to-day life. So from bathing to dressing to cooking, anything that will help get you through the day, you really rely a lot on your vision. And sometimes we don't think about that well enough in advance. And sometimes we often think about it too late. One great statistic I love on this page is that people are actually 4 times more likely to go in and see their eye doctor than they are to go in and getting an annual physical. So when we talk about capturing those early chronic diseases early on, this is why we encourage eye exams, because not many of us are often going enough and getting our eyes checked. So now that we talked about the importance of an eye exam, I want to talk through about the diversity of our network as well. The WHA plan really does have a great network behind them. It's EyeMed's network. And the great thing is we have a network that encompasses so many different types of providers, not just your small mom and pop shops, not just your big box retail providers, but we have everything in between as well. So when I talk about a national provider, in the next slides, there'll be some examples of this. I'm talking about your Target Opticals, your Lens Crafters, your big box that you typically see in almost every state. Then you've got your smaller regional providers. You're thinking America's Best, Clarkston Eye Care. Some of those are more regionalized, maybe in certain states. And then most importantly, our independent providers. We have a great mix of independent providers. We have about 77% of our providers are actually independent, smaller providers. And I think that's a great way to show that we don't just focus on the big name, big box stores. We also have a great smaller or bigger independent provider network. And then one online provider piece actually is a growing space. Many of us think about glasses and we think you have to go to a brick and mortar store to purchase the glasses, but no, we have some great online in-network options where when you go to these sites such as lenscrafters.com or targetoptical.com, you can actually utilize your benefits right on the site and get your glasses delivered to you to your door with no shipping costs to you. So we'll go over that in the next few slides as well. So some of the retail providers that I mentioned Lens Crafters, Target Optical being some of the national ones. Some of these other ones may even be familiar to you. America's Best, I know are very common these days. These are just some of the regional providers that may be familiar to you that are all in network with your plan. Now, next, I mentioned the online in-network options. So when we think of the online space, there's a lot of great improvements that have happened in our online in-network space. Our 6 online in-network providers are Lens Crafters, Target Optical, Ray-Ban, Oakley, and Glasses.com for glasses. And then we've got Contacts Direct for those who wear contact lenses. And as I mentioned, when you go into these sites, you'll just have to enter your name and your date of birth in the plan that you have, and it will actually go and find your benefits, and everything will be adjudicated right on the site. So there's no after purchase claims that you need to fill out. Everything will be done right on the site. And again, the glasses will be shipped to you free of charge. And if you have anything that that you need adjusted on the frames, if they are too loose, maybe they're too tight, and maybe they just fit a little wonky, you can actually go into any of our brick and mortar locations at Lens Crafters or Target Optical, which I mentioned are nationwide, and get those glasses adjusted free of charge. Now we can get into the benefits. So what does your benefit look like? I think we really need to break down the different parts of the benefits. So the first is the exam and lens copays. We're seeing on the right-hand side here, the $0 copay for the eye exam, which is great because it allows you to go in and get your eyes examined without having to pay any sort of copays. It really removes that barrier to care. Then we've got your frame allowances. There's 2 different types of frame allowances you may see for dependent on your plan design. There's a $100 allowance as well as a $200 allowance. And same with contact lenses for those who wear contact lenses. Note when you go to a larger store like a Walmart or any of those larger stores like a Costco, those are going to have a different allowance at those wholesale locations, mainly because those locations already have very discounted prices on their frames. So they do come with a smaller allowance. When we talk about the frequency, it's at the very bottom here, the 12, 24, 24. The 12 is for the eye exam piece. So you are covered for an eye exam every 12 months. So once a year. And then the 24, 24 is every 2 years. So you are covered for your glasses and your lenses every 2 years, which is typically how long glasses prescriptions last. In addition to your set benefits, the copays and the allowances I shared with you, you also get the additional 40% off discount for any additional pairs that you may purchase beyond your initial pair. Now, the 40% off is great because not only is it able to be used, anytime, it does not have to be used at the time of the first sale. You can use it at any point after your initial purchase. It's definitely one of the best and most flexible in the industry, and it really gives you the ability to use your benefits wherever you see fit. So if you purchase your glasses at a private doctor's office, your initial pair at a private doctor's office, you can grab your prescription and maybe go to a Target Optical and receive 40% off an additional pair there. Maybe you wanted to get a pair of sunglasses. So great additional discounts for members beyond just your traditional benefit. And beyond that as well, there's a lot of additional discounts on any non-covered items. So if you were to purchase a pair of frames that were beyond the $100 or beyond the $200, you do get an additional 20% off of that balance. Now for the member experience. So what does a member go through after they've enrolled in the plan and they want to go and get their eyes examined and get a pair of glasses? So there really is just 4 steps to this. The first is to find a provider. So when finding a provider with a great provider locator, which I will include in the next few slides. And then the next is you're going to go in and get your eyes examined once you find the provider. Last, you'll select your materials, pay your copays, and the rest you can actually do. Everything will be adjudicated when you go into the doctor's office. Now for the provider locator, you will be able to find a provider just by using your zip code. And there are some great filter options on there. So perhaps you want a doctor that speaks a certain language, or maybe you would prefer a doctor that has certain hours. You can actually filter for those things on the provider locator, and it will list the providers closest to you. So there's a lot of great different filters that you can use on there. And if you want to play around with it, feel free to, but it's very user-friendly. And this can be found through the WHA site, which we can certainly note in the next, it will include in this after this session. So if you haven't gone in and gotten an eye exam, what do you expect when you're going in to get an eye exam? So a comprehensive eye exam that's covered with a copay does include a wellness check. So includes any sort of issues at the back of the eye, the overall health of the back of the eye, as well as getting your refraction, which is your prescription to receive a pair of glasses. So when we're talking about the overall health of the eye, some of the things that you may get when you're getting an eye exam, some of the tests is the glaucoma test, or the dreaded puff of air test that everyone loves. The visual fields test to test your peripheral vision, a refraction test, as I mentioned, to get your prescription to receive your glasses, the slit lamp test to help check the back of the eye for any of those diseases I mentioned earlier, such as diabetic retinopathy, and then a view of your retina as well. So these are all things that are included within that comprehensive eye exam. So once you go in and you get your services at your provider and you pay your copays, the provider will do everything else for you. They'll submit the claim to EyeMed. The claims process will go through all of our internal systems. The provider will be paid out, so whatever they've been assigned, and then you will receive information on that visit. Any questions?
So Christine, I'm not seeing any questions now here in the thing, but I do have just kind of a review that if a member were to seek an annual eye exam with an in-network EyeMed provider, that is a zero copay, correct?
Yes.
Okay, because if they were to seek a in-network with their primary medical group, in this case, either a Hill physician or Mercy Medical optometrist for an annual eye exam, that would be a $25 copay. So that's one distinction I want to make sure that our members do understand and can take advantage of that zero copay.
Mm-hmm. Exactly. And I don't know what the differentiate because of this particular plan is. This is essentially supplemental to that plan. Correct, Eric?
That's right. That's right. It's a value-added benefit into the zero premium MyCare. And also on one of the slides for folks that are listening to this presentation, there is a $100 allowance every 24 months. In 2024, Western Health made a decision to not renew and move forward with the MyCare Plus HMO, which did have the $200 every 24 month. So that is no longer an option. It's just the $100 every 24 months.
I do see a question from Yolanda, and I'll make sure those updates are there, Eric, so that when you share this, that will have the updated information.
Super.
I need to see an ophthalmologist. Do I need a referral? I'm new to WHA. So an ophthalmologist is actually not covered in the routine eye exam. That would be covered under your medical plan. So perhaps, Eric, you may have a better answer for this.
Right. I was going to jump on that. So yes, Yolanda, in order to see an ophthalmologist, which is a specialist, you would need your primary care doctor to send a referral. Okay. Any other questions? I'm not seeing. So, okay, what I'm going to do, Christine, is I'm going to share. I need to wrap things up here, so bear with me. Okay, so we do have, for folks on the line that have been participating and enjoying these Let's Talk Benefits webinar series, we do have one, I believe, tomorrow on March the 7th regarding a benefit of mom's meals. And then again, I think it's on the 14th. Let me just double check. The 14th of March is the Optum RX, the new pharmacy benefit presentation. So that is coming up. You can go and find these webinars to register at our website right there. That's on the screen. And then for any of those that have questions, maybe you think of a question after we end this webinar and you want to discuss with me, feel free to give our Medicare sales office a call. The number here is 888-942-4777, and we'll be happy to address any questions that you have regarding what you heard or any other questions that you may come up with. So I'm not seeing Christine and other folks that were part of the EyeMed presentation. Thank you for taking the time out to be with us today. You guys have a great rest of your day and week, and I do thank you again. We'll see you next time. All right.
Thanks, Eric.
Bye now. You bet.